Yes.
Wonderful. Good morning, everyone. Blessed Thursday. Pursuant to Chapter 4, Section 85, Chapter 69, Section 2706 of the New York City Charter, a joint meeting of the Bronx Borough Service Cabinet and Bronx Borough Board will take place today, Thursday, January 19th, 2023, starting at 10:06, virtually via WebEx. Before I turn it over to roll call, I just want to make a quick announcement, and I believe she is on. On behalf of the Bronx Borough President, I would like to formally announce and welcome Ms. Kiara Cannon as our new Director of Community Boards. Her official start date will be sometime before our next borough board, but I just wanted to make the formal announcement via our meeting this morning. So please help us give a warm welcome to Ms. Kiara Cannon as our new Director of Community Board for the Bronx Borough President's Office.
Yay! Thank you, everyone. I'm really looking forward to it. Thanks.
Thank you, Kiara. Great to see you. So we will begin with roll calls. I will start with our community boards. CB1. I see Chair Parks is on.
Arlene, you're muted.
Hi.
Good morning.
Good morning, everyone. Arlene Parks, present.
Thank you. Good morning, Chair. CB2.
Good morning, Ralph Acevedo, District Manager, and congratulations to Kiara.
Good morning, Rafael. Community Board 3.
Good morning, Etta Ritter, District Manager, Bronx Community Board 3.
Good morning, Etta. Community Board 4. Community Board 5.
Good morning, Deputy Borough President. This is Ken Brown, District Manager, Community Board 5, and new subordinate to Kiara.
Good morning, Ken. Community Board 6.
Good morning, Rafael Mora, Community Board 6.
Good morning, Rafael. Community Board 7.
Good morning, Jahira Arias, Chair, CB7.
Good morning,
Carla Cabrera Carrera, Deputy District Manager.
Good morning, Carla. Good morning, Madam Chair. Community Board 8.
Good morning, all. Laura Spalter, Chair, Community Board 8. A special shout out to Kira. For us, this is bittersweet. We're thrilled that she has this promotion and she's still helping us, but it's bittersweet. We will miss her as our DM.
And good morning, Kira. I guess this is my last meeting as DM of CB8. I just wanted to thank you, everyone, for this opportunity. I'm really looking forward to continuing to work with all of you, even on a closer basis. So I'll see you all on the other side next month. Thank you.
Thank you so much, Community Board 8. Community Board 9. Community Board 10. Community Board 11. Community Board 12.
Good morning. Happy New Year to you all. Congratulations, Kiara. Tom, I'll miss you. And just chair of 12.
Thank you, Madam Chair, for joining us.
Good morning, Community Board 12, George.
Good morning, George. Moving to City Council. District 8, Councilmember Diana Ayala.
Hi, everyone. I don't know if you can hear me. Stephanie Herrera here for Councilmember Diana Ayala.
Good morning, Stephanie. District 11, Councilmember Eric Dinowitz. District 12, Councilmember Kevin Riley.
Good morning, Madam Deputy. Good morning, everyone, and Happy New Year. Simone Jones, Chief of Staff for Councilmember Riley, present.
Good morning, Simone. District 13, Councilmember Marjorie Velasquez.
Hi, this is Stephanie from Councilmember Velasquez's office.
Good morning, Stephanie. District 14, Councilmember Pierina Sanchez.
Good morning, everyone. Sam, Chief of Staff for Councilmember Pierina Sanchez. Buenos dias, todos. Good morning.
Buenos dias, Sam. District 15, Councilmember Oswald Feliz.
Hi, good morning. This is Kathleen, Councilmember Feliz's Director of Community Affairs.
Good morning, Kathleen. District 16, Councilmember Althea Stevens.
Good morning, everyone, and Happy New Year. This is Kate Connolly from Councilmember Althea Stevens' office.
And happy belated to Councilwoman Althea Stevens. District 17, Councilmember Rafael Salamanca.
Yes.
District 18, Councilmember Amanda Farias.
Good morning, everyone. Randy Malman here, Chief of Staff to Councilmember Farias.
Good morning, Randy. Great, great. And before we turn it over to our presenters, I just want to acknowledge the city agencies in the room. We are joined by the Mayor's Office, CAU. Alina is on. We have the Department of Aging, the Department of Finance, DOHMH, and DOT. Did I miss anyone?
Hi, DSS is here, Jocelyn Bennett.
DSS. And Parks. I also see Parks.
Good morning.
Beautiful.
Good morning. My name is Afia Mikulski. I'm covering for Kenneth Johnson at the Department of Health. He's on vacation.
Thank you so much for joining us.
Good morning. Maisha Taylor Mike, New York City Department of Education.
Beautiful, DOE. Thank you all city agencies and the Mayor's Office for joining us this morning. We have a jam-packed agenda, but all very important topics to discuss for the new year and as things continue, as initiatives continue to roll out. So with that said, I want to welcome the New York State Office of Cannabis Management. We have Pascal Bernard, Deputy Director of Intergovernmental Affairs, providing us with an overview of where we are in the process of the legalization of cannabis, but also citywide dispensary sites, and particularly the one in the Bronx. So I want to pass it over to the department, to the Office of Cannabis Management, OCM. Pascal, the virtual floor is yours. Thank you for joining us.
Thank you. Good morning, everybody. I'm joined by two of my colleagues. I will let them introduce themselves quickly. Phil.
Hello, everyone. My name is Phil Rumsey. I am the manager for intergovernmental outreach here at the Office of Cannabis Management.
Adam.
And good morning, everyone. Adam Soneski, Program Specialist with the Office of Cannabis Management.
So thank you very much. We were here several months ago, like sometime last year. So we're happy to be back. And also want to shout out Kiara. We actually reached out to CBA and she and her team were super helpful. So I'm not surprised that she's gotten, elevated, and congratulations and good luck. Phil, are you ready to share the slides? Yep. So as he's putting them up, the first several, it's information that you may recall. So I'll just go through them quickly. We will, as we're presenting, Adam will be putting things in the chat, links in the chat, and then Adam will send an email to the Borough President's Office with the slide deck and all the links in case you don't get everything. So please don't feel, pressured. All right, let's start. First slide, please, Phil. Next slide, please. Yep, thanks, Phil. So as you know, cannabis is a plant. It's been used in industrial, food, wellness, recreational, medical, and pharma. It's the same plant as hemp. The only difference is they start the same plant, and once it gets to a certain THC level, which is then it becomes cannabis. So hemp has 0.3% less THC than cannabis. And the THC is what gives that euphoric feeling. Next slide, please. So people 21 and over can buy and possess recreational cannabis in the state. It's up to 3 ounces of flower, 24 grams of concentrate. You can consume it in the privacy, in a private home, or in a state licensed on-site consumption site. Currently, we don't have any licensed consumption sites as of yet. And wherever tobacco smoking and vaping is allowed, cannabis smoking and vaping is allowed. Next slide, please. So this is actually a new slide for you all. So as of October 5th, people were able, certified medical patients were able to home grow their medicine. And so only the certified patient or their designated caregiver who is 21 and older can grow cannabis for the patient. And this is someone that's registered in our medical cannabis program. There will be recreational home grow. So 18 months after the first dispensary opens in New York State, people 21 and older will be able to home grow 6 plants, 3 mature, 3 immature plants for a maximum of 12 plants per household. We open our first dispensary. We open our first dispensary on December 29th in Lower Manhattan. So 18 months after December 29th. People will be able to home grow. Next slide, please. So the Marijuana Regulation Taxation Act, as you may recall, we call that MRTA or MARTA. The MRTA was signed into law March 31st of 2021. It established the Office of Cannabis Management as well as the 5-member Cannabis Control Board. And there is a 20-member Cannabis Advisory Board, and it legalized recreational cannabis, as well as expanding our existing medical cannabis program and cannabinoid hemp. And it shifted the framework to a public health framework. And so the members of the Cannabis Control Board, as well as the Cannabis Advisory Board, are New Yorkers from across the state. Next slide, please. Again, we oversee adult use recreational, medical cannabis, and hemp. And as you may recall, once the MRTA was passed, one of the first things that happened was automatic expungement of past marijuana convictions for New Yorkers. Additionally, one of the things that the MRTA emphasizes is 40% of the tax revenues will go towards rebuilding communities that were disproportionately impacted by the war on drug and prohibition. And there is a goal of awarding 50% of adult use licenses to social and economic equity applicants. And also our amazing equity team has to provide a social and economic equity plan. Next slide, please. And so this is the tax system. You may recall it from the last time. So instead of a THC per milligram, we're doing a weight-based tax. And as you can see, this is what the taxes will look like. So 0.3 per milligram for edibles, 0.5 for cannabis flowers, and 0.8 for concentrates. The state will get a 9% state excise tax. The municipality will get a 4% local excise tax. Next slide, please. And so the fund, all the revenues will go into the New York State Cannabis Revenue Fund. 40% will go towards education, and that's across the state. 40%, again, will go into community grant reinvestment, and these will be for communities that were disproportionately impacted by prohibition. And then 20% will go towards drug treatment and public education. Next slide, please. So now we're going to talk about the opportunities. So these are the the 9 license types. And currently under the MRTA, we've not issued any licenses for any of these license types, but these will be the various licenses that people across the state will be able to, apply for licenses with OCM. Next slide, please. So one of the things that we've done is we've created a tiered system. And so this is new information for you. And so what we're trying to do is ensure that no person has direct or indirect interest across tiers. This includes any stock ownership. And so there's the supply tier with the cultivation, nursery, distributor, and processor, the retail tier with the dispensary, on-site consumption and delivery, the medical tier, which is the registered organizations for our medical cannabis patients, and then the laboratory tier. And so they'll be sampling, the product. Again, this is to ensure that, there is no one person that has direct or indirect interest across the tiers, and really looking to create opportunities for small and mid-sized business owners across the state. Slide, please. So as you may recall with the ancillary businesses, the last time we talked, again, if people have businesses, they can turnkey their business to support the cannabis ecosystem that we're trying to build. I know actually of a business in the Bronx, Johnson Security, so they can turnkey that and provide security services for people in the cannabis industry. If people are graphic artists, they have to just look at our proposed regulations and really understand how they can do the artwork for the packaging that these dispensaries will be using and things like that. Next slide, please. So the conditional use conditional use licenses. So the MRTA, we have 9 license types. And when the board met November 21st, we provided proposed regulations for all those 9, for most of those license types. We're still working on the consumption lounge. But we also have conditional licenses, and these are standalone, and really think about it as licenses that help jumpstart the cannabis, the legal cannabis industry here in the state. And so we had adult use conditional cultivator license, adult use conditional processor license, and the conditional adult use retail dispensary license, which we call CARD. Next slide, please. And so, the cultivator, we had to grow, the processor, we have to process it, and now we're at the point where we're ready to start selling. And so thus far, we've had about 280 farmers across the state and get those licenses, and we still have some applications under review. For the processor, about 38, and some licenses still under review. So for the conditional adult retail dispensary license, our target is about 175. Thus far, we've issued 36 licenses, and that was done at the November 21st meeting. And to be eligible for the CARD license, there were 2 eligibility groups. One would be individuals, another were nonprofits. So for the individual, it would be an individual or an eligible family member, and you had to have a New York State related cannabis conviction, experience owning and operating a qualifying business, and some other requirements. And for the eligible family member, it was either a parent or guardian, a child or dependent, a spouse or ex-spouse with proper documentation. And for the nonprofits, it was organizations intentionally servicing justice involved individual and also engage in some kind of enterprise. And so the first card licensee that opened was Housing Works in Lower Manhattan because they fit that 501c3 profile. Next slide, please. And now I'm going to turn you over to Phil.
Okay, thank you very much, Pascal. So I want to shift a little bit here and talk about enforcement. We know that this has been a problem across the state. Every time we speak with a municipality, we end up speaking about our enforcement efforts. And to be clear here, we're talking about a few things. One is the sticker store issue, where there'll be a pile of stickers on a table and someone will come in, give $80 to an individual, and they'll hand them a sticker, and then they'll slide some cannabis across the counter and call it gifting. Gifting was referenced in the MRTA. However, this was between individuals and friends. This was not meant for a brick and mortar entity. And that's what we've seen cropping up across the state and certainly in New York City are these brick and mortar stores that are operating illegally and selling products illegally. Since the very beginning of the Cannabis Control Board and Office of Cannabis Management, we have been talking about and addressing the illicit market. October 21st of 2021, we had Chair Wright of the Cannabis Control Board and Executive Director of the Office of Cannabis Management, Chris Alexander, both issuing statements on gifting. In January of 2022, we began sending out cease and desist letters to suspected illicit retailers. We followed that up with a July 2022 press release that detailed these efforts. And our OCM enforcement staff are working daily to crack down on these businesses, these locations, and work as many investigations as they can. Right now, in order to tackle this issue, we're using existing laws. And what we found, which works the best, are existing building, zoning, or healthcare laws. This is really a nuisance abatement issue where we're using these existing laws in order to crack down on these brick and mortar stores. One of the reasons that we're using this method is that in the MRTA, in the Marijuana Regulation and Taxation Act, the OCM was given jurisdiction over licensed entities. And currently there is one licensed entity that's allowed to sell cannabis in New York State. So all the rest of them are illicit. In order to crack down on these more, in order to make sure that we can make the ecosystem as best we can for the legal market, we are anticipating future legislation this session. And that's going to shift a few aspects of the MRTA. One, it will give us jurisdiction over cannabis. Again, right now, if there is an illicit activity in a bodega, in a gas station, in a pizza place, we don't have jurisdiction over them because they are not licensed entities. Again, there's only one. So this legislation will help us have a little bit more jurisdiction over cannabis itself. And it will also allow us to work with the taxation, New York State Department of Taxation to crack down even heavier on different kinds of fines and taxation on the product itself, which we do feel will go a very long way in helping us start to break up this illicit brick and mortar store. If you come across one of these stores, we certainly hope that you'd be able to flag this for us and send some information to the complaints@ocm.ny.gov email. This will help our enforcement team kick off their investigation and look into what's going on in this location and come up with strategies to best eliminate it. The OCM Enforcement Division has been conducting investigations since January of 2022. They are constantly working with local DAs and law enforcement about the best strategies in order to help crack down on these and what's worked best in different areas. Their division continues to staff up, and they are visiting illicit stores. They are continuing to send the cease and desist letters and assisting in local law enforcement and their investigation. As an example, we did recently assist the New York City Sheriff in impounding 16 illicit truck dispensaries in New York City. Some of the ways we did that was looking at registration, looking at what they were permitted to sell and not to sell, and crack down on it that way. And again, we hope the future legislation will only increase our ability to tackle these problems. So retail guidance, I want to kind of go over some of the broad points of what you can expect to see in the retail guidance environment. First and foremost, we do have a document called Guidance for Adult Use Retail Dispensaries. These were given out to card licensees. And it's a phenomenal document that goes through a lot of the requirements and expectations OCM has for these retail dispensaries. This includes inventory tracking, location security, facility requirements, branding, marketing, signage. This document is very enlightening on what you can expect to see from the dispensaries and the kind of structure that they will all have once they open. Again, we will be sending this around in the chat, but also in a follow-up email to make sure that you can all take a look at this. Excuse me. So the MRT regulations, just November 21st of this year, the Cannabis Control Board approved the adult use program regulations that will establish the cannabis ecosystem. The regulations included the application and license selection and renewal process, key social and economic equity program provisions, environmental and sustainability standards, and general business operating requirements, including security, record keeping, and transportation. These are a couple of very large regulation packages that we did pass. The proposed regulations have been filed for their initial 60-day public comment period. They were filed on December 14th of last year, and this will go through February 13th of this year. We certainly want to hear from the community. We want to hear from individuals who are interested and want to partake in the cannabis ecosystem. And we ask everyone to take a look at these regulations and send any comments to us through the regulations@ocm.ny.gov email. We want to hear from the public. We want to hear from institutions. We want to hear from individuals and people who, again, want to participate in this ecosystem. We know that things can be improved. We know that people have different opinions and perspectives that they can bring to these. So please take a look at these regulations packages. Let us know where you think we can improve. Let us know where you think we need to bulk things up or maybe tone things down. We want to hear from people. So again, that regulations@ocm.ny.gov email is the best place to send your comments. So staffing and training, we will have an employee in charge. This will be an individual who's 21 years or older. They will act as a general manager, and they will be a main point of contact with OCM's compliant unit. So we are going to have a point person at these dispensaries that we'll be able to interact with, talk with. If there's some sort of emergency we need to flag or something along those lines, we can do that. We're not going to be calling these stores blindly. We will have a permanent point of contact. This person will be expected to submit any required reports and make sure that the records are kept in compliance with OCM requirements, and also ensure that all dispensary employees are trained in accordance with our manual. The training manual, it's actually outlined in section 4 of the retail guidance document I just discussed. This lists all topic areas that must be included in the manual and the when you're training employees. So we will have at these retail locations some, we address the advertising. All advertising, including product displays, cannot be visible outside the store. So this means no window displays. You can't advertise giveaways, loyalty programs, or highlight price reductions on the menu. For external signage, you may have signs outside showing where the dispensary is. There is a limit for 2 dispensaries, 2 signs per dispensary. And the signs cannot have a logo, symbol, or imagery. And it may have the business name, location, contact information, business type, things of that nature. And one of the reasons that we have taken this approach is that we have learned from the tobacco industry and the decades-long struggle it took to make sure that they were not going out of their way and blatantly advertising to individuals 21 years or younger in this case, or 18 years and younger back in the day with tobacco. We've learned lessons from them, and we have taken steps to make sure that this is not an industry that anyone licensed by us will be able to market to children. So sales and transaction. With the menu prices, a dispensary will have to show both the price of the product and the total price with the tax on the menu. Again, they won't be able to advertise the sales, giveaways, and they won't be able to put price reduction or have a points-based reward system, customer loyalty programs. Also using the word sale or free, price drop, or discount on the menu. We want to make sure that when someone comes in, that they're not doing it because of a flashy sales gimmick or some of the other kind of pitch words that we've seen. We want to make sure that people are entering these locations because they want to partake in the some of the products that we have, the cannabis products we have, and that's the main reason they're heading in there. With a customer transaction, the retail guidance includes information that outlines the requirements related to customer sales. This includes age verification, making sure that no one is able to come in who's not 21 and up. There is a right to refuse sales. Dispensary workers can refuse to sell to a customer. Excuse me. Oops, sorry about that. Can refuse to sell to a customer. If they fail, it would result in the customer exceeding the legal possession limits, or would create a risk or diversion, or would be an individual who is 21 or younger. So we are giving individuals some discretion at dispensaries as far as who they are selling to. Customer education. We want to make sure that customers walk into these stores and understand what they're getting into, make sure that they understand the difference between a tincture bottle and a joint, and a edible. And not everyone does. A lot of people will be coming into these stores not understanding these distinctions. And we want to make sure that the employees there can walk an individual who may know very little to nothing about the cannabis world, and make sure that they end up getting the right product for themselves. So again, we want to thank you for your time and the invitation. Last two things I want to mention here is that if you have any upcoming events that you would like us to be aware of, please email events@ocm.ny.gov. And if you would like to receive regular updates from us, you can go to our website, cannabis.ny.gov, and you can put in your email, select different topics you're interested in, and we'll be sending out updates moving forward here. So with that all being said, I will stop my screen here. And as I like to say, unless we happen to address everything perfectly, maybe no one has any questions. However, in my experience, there often are quite a few questions at the end of these. So I think now's the best time for us to kick that off.
Yeah, and right before we open it up for questions, I just want to address that I know that OCM is working on info sessions with community boards. If Pascal, if you want to make mention of that for the folks that are on.
Thank you. Yes, we are planning info sessions with our executive director. It's strictly for community board members and staff. We realized that we didn't have an evening option, and so we're working on creating an evening option because we do know many of the community board members, you know, a lot of them work regular 9 to 5, but we have 3 options simply because we know people work different shifts and they have different lives, and so we just really wanted to be responsive to that.
Great, thank you. So we'll open it up to questions, keeping in mind that we're a little tight on time. So we'll try to do 5-10 minutes tops for questions. We have another presentation right after this that's extensive as well. So opening it up to questions. I believe, George, I saw your hand raised early on.
Yes, thank you. I have 2 questions. The first being, and I'll be real quick, did the current law, the law that we have now, change the requirements on selling marijuana? The reason I ask this is because you mentioned, rightfully so, there's only one dispensary in the city of New York right now, which is, I believe, in Manhattan. Yet we have a proliferation of these types of facilities throughout the rest of the communities, and especially my community board and other community boards. And when we've taken this to the NYPD, or we complain to Consumer Affairs or other agencies, regulatory agencies in the city of New York, they've all complained or all said, well, marijuana is legal now. You know, there's nothing we can do. I saw the hearing the other day with the city sheriff testifying before the city council. I'm just curious, did they change the law? Because selling marijuana was illegal. And I thought that the only way you could sell it was if you were a licensed vendor. Yet you still have people who are selling it on the street, which I think is illegal. You still have people selling it out of trucks. Yet the way you're attacking it is through using zoning violations and other types of violations, which I find curious. So I'm just curious, did they actually change the law that I'm unaware of? I'm not an attorney, so I'm just curious, did they change it? And my second question, you're creating the system which, as community boards, we're slightly familiar with the State Liquor Authority and the dispensing of liquor licenses. Is this going to be similar? Because we have, as community boards, a history with the SLA, and we're not necessarily happy with the way that they do their enforcement. So I'm just wondering if you're creating this sort of another oversight or enforcement agency that we're going to have to go to you to sort of enforce things which should be enforced. So, for example, with SLA, and talking about zoning, restaurants are required to have particular zoning in place and have jobs signed off. Yet I have seen, as I worked in the buildings department, jobs not be signed off by the buildings department on kitchen work or fire alarm systems or stuff like that. Yet they're still able to open one, and they're still able to get their liquor licenses despite the fact that they have uncompleted jobs and don't follow city ordinance on buildings violations or other regulatory issues that the city has before them. So are you going to be the same way? Is a dispensary going to have sign off and for example, a certificate of occupancy from the buildings department on before they're able to open?
Good question.
Yeah, those are my two questions.
So thank you for your questions. As it relates to enforcement, actually, I know it's been a really packed week, but the hearing was yesterday, and I watched most of it as well. And so you know that there is a joint task force with the New York City Sheriff's Department, the NYPD, the Office of Cannabis Management. They pull in DOH, MH when necessary. They pull in worker protection when necessary. And we are aggressively going after the illicit shops as well as the trucks. And so we are doing a lot around that issue. And even several council members themselves recognize that there is a lot of activity around this. And even they themselves, recognize that, there may be a need for greater tools at both the municipal and the state level. The MRTA allows the Office of Cannabis Management jurisdiction over licensed entities. And so these are unlicensed entities. And so this is part of why, this task force is put together, because the Sheriff's Department has greater jurisdiction over those kind of things with seizures and, all the tools that they have in their arsenal to kind of deal with this. But there are, and Phil talked about it in his in his portion of the slide, we are working with the state Senate and the state Assembly and really looking to increase our ability to go after unlicensed shops. But also, I don't know if you were around when Senator Kruger, provided testimony yesterday. She talked about, working at the state level to, again, ensure that we have the right tools that we need to go after, these people who are trying to take a shortcut and who are trying to, work around the law.
But I guess my question, the crux of my question is, it's always been illegal to sell drugs in the city of New York. Marijuana is a drug. So to your point that you are not selling this, we're talking about unlicensed people. Why is the NYPD, why is it that you see that this is your need to enforce? Why can't the NYPD go in and arrest these people for selling drugs if they do not have a license?
So I know in the
More
initial
change is what I'm asking.
So in that first panel, it was the sheriff and it was someone from the PD that was there as well. And I know that they are part of the task force. I can't speak to specifically, why the NYPD is or isn't doing something. They're a city agency. We don't have purview over them. So I specifically can't answer why the NYPD is not doing something. I'm sorry, that's just the reality. I can't answer that part.
No, it's cool. And how about just the SLA part?
So when you talk about SLA, what specifically, because I know that the community boards provide SLA with an advisory opinion. Is that what you're talking about? Yes,
Well,
it's the
yeah,
same.
I want to figure out what our role is in that application process, because we have something similar in the SLA. And again, you spoke to the enforcement side where they're supposed to have, I would imagine, and I'm only speaking from my experience with SLA, there are certain regulations and city ordinances that have to be followed in order to open up a restaurant. Are you guys going to be similar in that same vein, in that a building is going to, or the store is going to be required to have a certificate of occupancy, have a sprinkler system installed, adhere to, for example, in commercial areas, adhere to performance hours, mandated hours, 9 to 5, 9 to 6, 9 to 7. Those are all things that we can put into any licenses that are granted to stores or to liquor establishments. Are we going to have the same ability? And you did point out it's advisory, but most of the time SLA does work with us. The only concern that we have as district managers is that sometimes when we get complaints from the NYPD about a troublesome establishment, it takes them a very long time to sort of enforce. How is whatever it is that you're creating going to react, and what do you think the turnaround time is going to be on enforcement when we start receiving complaints about particular stores?
So it's hard to tell you what I think the turnaround time will be, just because this is all very new, and we don't have precedents like SLA. We don't have the depth of experience like SLA. We literally opened our first dispensary on the 29th. And so it's hard for me to give you what an estimation would be. I know that's not what you want to hear, but that is the reality. As it relates to what the businesses have to do, the dispensaries that are opening now, they are following, we license them. They have to provide us with a ton of information. And some of that is in one of the documents that Adam put in the chat. It was also emailed to community boards. So they have to provide us with a lot of information. And, they also have to follow local ordinances as it relates to certificate of occupancy and all of those things. And this is across the state. And so, they will have to continue to do those things. Phil, I know you look like you were about to say something as well.
Yeah, I mean, I would just to kind of piggyback off what you just said. The quick answer is yes. I mean, all fire codes have to be followed. All building codes have to be followed. If we've been asking municipalities to make sure they treat cannabis the way they would any retail. So certainly the building and fire codes and things like that. Yes, they absolutely. There's no bubble around a dispensary or any other aspect of the cannabis industry that excludes it from any kind of fire and safety code or something like that. So absolutely, they will be followed. I think generally speaking, yes, to Pascal's point, it's somewhat similar to the SLA process in that an advisory opinion that will be weighed and measured by the Cannabis Control Board can be issued by community boards. And when the community board issues their advisory opinion, it will be one of the factors weighed to determine whether or not a licensee can continue moving on their process or continue with that location. So it's certainly one important element that the board uses to determine whether or not a license will be issued.
And also, we have an enforcement team. We have a wonderful enforcement team. These are professionals that have come from other, state agencies. There are some that have come from city agencies, and they brought their talent to OCM. Collectively, they have over 200 years of experience. And for the dispensaries and the entities that we license, that is the check and balance. They will be able to go in and do unannounced checks on them. So when everything is up and running, if there is a complaint about a dispensary that's not operating within the confines of the MRTA, you should report that to OCM. That is what we are supposed to do.
Okay, I'm so sorry for the interest of time, just because our next presenter is also a very important one. I just want to reiterate that OCM is having one-off or different sessions for the community boards. And Pascal and the OCM team, I think what's important here and what I did not hear was the need for the community boards or community representatives to be a part of this task force, the enforcement task force. These are the folks that are on the ground. These are the folks that we're literally seeing things operate.
We can't hear you.
Hear me now?
Yes.
Okay,
Yes.
sorry. Again, I just wanna emphasize, and I think this is what the community board is trying to express, and I didn't hear that as part of OCM's response, is really including the community board as part of the task force from the enforcement end. The community boards and, you know, community leaders are the folks that are on the ground seeing these operations, whether it's from a truck or a street vendor, et cetera. These are the folks that are constantly seeing, and I think that there is room for error, right? There is some level of oversight, but we need confirmation that the community boards are going to be a part of this conversation when it comes to enforcement, especially when there are initiatives that are being rolled out from OCM to, you know, establish sites, whether it's dispensary sites or other type of educational sites. It's important to include the community boards and the different elected offices to be a part of the conversation. And unfortunately, we do have to move on to our next presenter, but I know Pascal, I just want to mention to everyone, Pascal has always been great in terms of responding to us, being willing and able to come and present for us. The OCM team overall is just amazing and super responsive. They have a ton of tools and resources up on their website, and I know that they're sharing a lot via the chat. So OCM, if you can just please stay behind and share some updates and respond to some of the questions that are going on in the chat. And again, apologize for cutting that short. But thank you, OCM, for being here and presenting for us such short notice and a quick turnaround. We appreciate you all.
Our pleasure. We love the Bronx.
Thank you. We love the Bronx too. Really quickly, I just want to acknowledge that DEP and CCHR are also on our have joined our meeting, and with that, we will move towards our next presenter, DOHMH, presenting on overdose prevention centers. DOHMH, the virtual floor is yours. Thank you.
Thank you. My name is Dr. Jonathan Giftos. I'm the Assistant Commissioner of the Bureau of Alcohol and Drug Use at the New York City Department of Health and Mental Hygiene. And let me see if I can share my screen. All right. Can everybody see my slides okay? Great, great. So this is a short presentation and hopefully there'll be some time for questions. So I'm going to start by just noting that we're going to talk today about overdose prevention centers, but I want to just give a little background. Just last week, we released our 2021 mortality data, unintentional drug poisoning. And as you can see, we've seen a steady increase over the years with more recent spikes in overdose death numbers. You can see that in 2021, the last year that we have final overdose numbers, 2,668 New Yorkers died of an unintentional drug poisoning or overdose. We're going to talk a little bit about these numbers in the context of the Bronx. We're going to talk a little bit about some of the drivers of this and the role of overdose prevention centers and hopefully reducing and bending the arc of overdose death in New York City. So as you can see, Bronx residents make up 16% of New York City's population, but 29% of all overdose deaths in New York City took place in the Bronx in 2021. And of the neighborhoods in the Bronx, 5 of them had overdose death rates that were higher than the New York City average. And the top 4 neighborhoods were a collection of neighborhoods with the highest overdose rates in New York City were in the Bronx. This is Hunts Point and Mott Haven had the highest overdose rate of the entire city, 119 deaths per 100,000 residents. Crotona Tremont, Highbridge Morrisania, and Fordham Bronx Park were in the top 4 of the city overall. Pelham Throgsneck was the 5th that had a high overdose rate greater than the city average. And so we're seeing really striking overdose death numbers in the Bronx in 2021, and this is a continuation of high death rates in the Bronx from overdose over the past several years. If you were to compare the the South Bronx to the rest of the country, we have the highest rates of overdose death in the entire country. In the South Bronx, that compares to other places in the country that have seen substantial overdose deaths, such as West Virginia and other parts of the country. So what are the major drivers of overdose death? Why are we seeing so many more people dying? So we as a health department break down the drivers of overdose death risk into three main categories. There's the individual person's risk. There's the risk conferred by the systems that they are engaging with. And then there's sort of policy and social risks that we're going to talk about. On the individual level, individuals using multiple substances, individuals using a loan where somebody couldn't respond with naloxone to reverse an overdose, or using following a period of decreased tolerance. So people sometimes coming out of treatment settings or picking up or using after a long period of recovery are at the highest risk of dying. From a systems perspective, we know that a lot of our interventions can reduce overdose death risk, but if people can't access them or they find them not helpful or they don't feel safe or welcome there, then they're not going to be able to benefit from them. Insufficient harm reduction services, which we're going to talk a lot about today, or inability to access them, having the hours not cover enough of the day, limitations in geography, as well as limited recovery supports for people in early recovery, employment and housing opportunities, and other social supports. And the bigger social and policy determinants of overdose risk include stigma and social isolation, people not feeling being discriminated against or excluded from spaces where they can receive support or feel safe, lack of affordable housing, which we know is a risk factor for so many health harms, historic criminalized approaches to drug use that kind of destabilize people's lives through frequent and disruptive contact with the criminal legal system. And the major driver is really the unregulated drug supply. The drug supply over the past several years has increasingly included fentanyl in drugs sold as heroin or sold as dope. And that fentanyl presence is the major driver of overdose death. 80% of overdose deaths in 2021 involved fentanyl. We're also seeing other substances in the drug supply, such as xylazine, which is a veterinary tranquilizer, and other substances that are putting people at substantial risk. So how are we reducing drug-related harm, including overdose death, as a city? So this is not going to be a comprehensive talk on all of the things that we think are important, but I do just think it's critical to note that we're going to talk about one intervention today, but not one single intervention is going to bend the arc. We need investments in a continuum of supportive services for people. And these include prevention services, harm reduction services, treatment services, recovery support, built on structural investments in housing, employment, and healthcare that are critical for everyone to feel healthy and safe and stable. The 5 key priority areas for us as a city as we strategize around our overdose response plan include the following 5 areas. We hope to expand and enhance our non-fatal overdose response efforts. This includes naloxone distribution and other our Relay initiative, which engages people in emergency rooms after a non-fatal overdose to connect them to supportive services. We hope to expand reach and scope of harm reduction service delivery, which we're going to talk about. Optimize availability, accessibility, and acceptability of evidence-based treatment. So New York City actually has a lot of treatment relative to other parts of the state and the country, but they're not always accessible, or people don't always feel welcome or safe there. And so a lot of the work is trying to make places more easily accessed and for people to feel more comfortable and safe when they're there. Investments to strengthen communities and reduce social isolation. And there's a lot of work being done in this space that expands much broader than the health department, that touches on a lot of city agencies. And then lastly, understanding and responding to an unregulated drug supply. So we're just going to talk about harm reduction briefly and then talk about overdose prevention centers. So the city has a longstanding history as leading in the development and implementation of harm reduction service delivery. We distribute over 150,000 naloxone kits each year through our opioid overdose prevention programs. We provide funding and technical assistance to 15 syringe service programs, or they used to be called needle exchanges. These are places where people who inject drugs or use drugs in general can access harm reduction services, sterile supplies, overdose education, and a lot of other important services. And we have 3 located in the Bronx. You may be familiar with St. Anne's Corner of Harm Reduction, which has really been a pioneer of innovation in the harm reduction space, Boom Health, and Bronx Mobile, which is a mobile harm reduction service that exists. And we have a fentanyl test strip distribution effort and a drug checking pilot program. And St. Anne's is one of the sites for our drug checking pilot. That's where people who use drugs can have a DOHMH technician test their drugs so that they know what in fact is in them and use that information to change potentially how they use drugs to reduce risk. That's in its pilot phase, and St. Anne's has been a partner of the city in that work. We're expanding access to medications like buprenorphine and methadone, and these are the single most effective way of reducing overdose risk for people with opioid use disorder or people who have an inability to stop using opioids like heroin or prescription pain pills. And lastly, we fund wraparound services and support the evaluation of 2 overdose prevention centers at On Point NYC. And we're going to talk a little bit about overdose prevention centers. So as you may know, in November of 2021, the city opened the nation's first authorized overdose prevention center at On Point NYC, which had 2 sites, one in East Harlem and one in Washington Heights. OPCs, which is the shorthand for overdose prevention centers, are evidence-based strategies to reduce overdose death risk. And they have existed around the world for many, many years, but they have yet to be an authorized overdose prevention center in the United States. Overdose prevention centers are hygienic, supervised facilities that provide education, equipment, and oversight of drug consumption in order to reduce harms from drug use. They also provide and connect people to health and social services. Supervised drug consumption is one part of the continuum of services for people who use drugs. And the city funds the wraparound services at these sites. So they fund all of the overdose education work. They fund the provision of sterile supplies. They fund the doctors and the nurses and the nurse practitioners that are on site to provide primary care, mental health care, wound care, and additional services, as well as food services and outreach and syringe litter efforts at the sites. But OPCs currently rely on private philanthropy to support the supervised consumption part of the site. And that is because of some ongoing questions around whether municipalities can use public dollars to support interventions that may be in violation of certain federal laws. And there's a lot of ongoing discussion around this at the federal level, as well as at the city and state level. But at the moment, OPCs rely on private philanthropy to support the supervised consumption element. So just to sort of show where the overdose prevention centers sit, you may have seen this map before. This shows all the neighborhoods in New York City, or lists all the neighborhoods in New York City that have overdose rates higher than the New York City average. And the darker the shade of blue, the higher the rate of the overdose. As you can see, the top 5 communities with the highest overdose rates are inside these red lines on the map, and the yellow diamonds reflect the placement of the 2 overdose prevention centers. And so these 2 sites are located in or near the neighborhoods with the highest overdose death rates. They were also cited within existing harm reduction programs. So they did not involve citing in new spaces. They were part of organizations that have been doing work in these communities for many years. And so if you remember the earlier slide where I described the 5 priority areas for the city, there's a lot of independent initiatives that are involved in those 5 priority areas, but also to say that overdose prevention centers in and of themselves advance all of these priority areas for us in communities. They allow for rapid intervention during a non-fatal overdose to reduce traumatic ER utilization. This is absolutely striking. So they've had 55,000 utilizations in just over 1 year by 2,309 people. They've had 700 overdose events that staff have intervened on. They've only called the ambulance 10 times, and they've had 0 deaths on site. And I think the EMS call is really important. I used to be a doctor and I worked on Rikers Island. I worked in the shelter system. We would see sometimes 10 overdose events a day in some of our high-risk settings, with ambulances coming and going and coming and going. And the sound of sirens and the trauma from these non-fatal overdoses was really disruptive to communities. And so just imagine this utilization of an overdose prevention center over a year. They only called EMS 10 times. And those were cases actually where the medical issue was secondary to the overdose. So the person may have been having an asthma attack or had an infection from a wound or something that was secondary to the overdose. Overdose prevention centers expand the reach and scope of harm reduction service delivery. So they're engaging thousands of people at highest risk of death that are extremely isolated and vulnerable. They have on-site treatment and the ability to do warm handoffs into treatment. So for people, when they're ready, they can access a trusted provider, but that program can also help provide warm handoffs into additional treatment settings. Reduce isolation. 76% of participants in the first 2 months of operation at the Overdose Prevention Center that said that they would have used publicly if the Overdose Prevention Center were not there. And this means in parks, in alleys, abandoned buildings, bathrooms of our businesses that are not Starbucks and McDonald's and are not designed to be public health spaces, right? And so 76% of participants would have used publicly if the Overdose Prevention Center were not there. And lastly, the drug supply, by co-locating our drug checking services within overdose prevention centers, we've been able to identify changes in fentanyl concentration in the drug supply that have been extremely dangerous, as well as the emergence of xylazine in New York City. And we've been able to provide guidance to our emergency providers, as well as our harm reduction organizations, on how to respond to xylazine-related health complications. So they've been an incredibly important resource for us as a city. But right now, they're only located in 2 spaces. We believe that we will not be able to bend the arc on overdose in New York City without expanding overdose prevention centers further to reach our most vulnerable people. But finding sustainable funding pathways for overdose prevention centers is the major challenge at the moment. And we look forward to continued conversations and the evolution of that discussion over the next several months. And I'll stop there. I know there may be questions. So happy to.
Yes, thank you so much,
further.
Doctor. If we can have, thank you so much, Doctor. We will take questions now, 3 minutes tops. We also have DOF presenting. Any questions? I'm not seeing any hands raised. If I'm missing you and you have your hand raised, please feel free to unmute. Doctor, I am not seeing any questions. Any final words?
I know it's a heavy topic. I know that everyone cares a lot about the overdose death rates in the Bronx, and we look forward to continued conversations with the Borough President's Office and the community boards around the city's plan moving forward.
Thank you. Thank you so much. And again, thank you so much for your time and the presentation. Is there a way that presentation could be shared with the board?
Yeah, I can see what we can do. Yep.
Okay, great. Thank you so much. Beautiful. So up next, we have an overview presentation of the Property Benefits Program by Michael Shar from the Department of Finance. Michael, you're up.
Well, thank you, Madam Deputy. Thank you for having us here. First question though, give me my timing so that I can hit my markers and get
You
your
have
meeting.
10 minutes.
I have 10 minutes.
Yes.
So I should stop talking to you and perhaps present, right? Well, it's good that we're here at this time. My name is Michael Sharp. I'm with the Department of Finance because this is actually the most important time for homeowners in the year. For homeowners, depending on what you do over the next 60 days, for some of you, you may end up paying thousands more or saving thousands of dollars on your property tax. And each year, unfortunately, homeowners pay thousands more than they have to by year. By law, because they don't take advantage of certain programs that are available to them. We could make that number go down in your community boards, in your districts, in our borough, if we are involved and share the information with our neighbors. If you only take one thing away from today's presentation, may it be that proactive and regular engagement with your community about the things we're about to discuss could actually put thousands of dollars back in the pockets of some. With that being said, let me do a few technical things and get this underway because I'm now down to 8 minutes, right? Okay. All right, are you seeing my screen?
Yes, we are.
All right. Hopefully it's the one that says Bronx BP 2023 with no notes. Okay. Are you still seeing my screen?
Yep.
Okay, very good. Let's go. Um, Each year, the Department of Finance sends out 1.2 million documents to homeowners. It's called a Notice of Property Value. 1.2 million, that's approximately. And it's the key to understanding and proactively doing something regarding your property taxes for many individuals. On your screen, you see a sample of what it is, and you'll notice at the top, it has Notice of Property Value. It has the year. The things you'll see is from last year. But then there's a note that says this is not a bill. Once people read that, unfortunately, they put it down a lot of time. And I understand why. Because in their other hand, they have a stack of papers that says this is a bill. And you kind of put that first. But please don't put this to the side and ignore it. Before, here's the key in many ways to understanding your property tax. We're going to do these 4 things today very quickly. And that is one, to review what this property of value statement is. We'll talk about ways to save for property tax exemptions, quickly review DOF websites and resources, and also give you a few reasons why you should attend the Bronx NOPV information session. It's coming up in February. So the NOPV document is a 4-pager that informs you of the Department of Finance's assessment of your property for the coming year. We're going to talk about each of these 4 pages briefly. The first page is an introduction page. It'll tell you who owns the property, at least some of the owners, its class, its borough, block, and lot. It'll tell you the market and excess values, key dates that you should know, and your property tax estimate. These, in this gray shaded area, 3 of the most important figures that you'll need to know when it comes to understanding your taxes: your market value, your assessed value, and any exemptions that you have. Also, at the bottom, here is your estimate of the taxes for the year to come. So this is what they will be starting for us now this year, for this was the latest document, starting July. Here's an estimate of the taxes coming up. Now on this same page, on the following page, you have an explanation of how we come to those numbers. starting with your market value, your assessed value, and something else called an effective market value. We'll get into that a little bit. And down here, you have instructions about how to challenge either the market value or the assessed value. But here's an example of the benefit of knowing or reviewing this material. Many times when people see a market value, they'll say, I cannot sell my house for that money. My house is worth $400,000, not $652. But what they don't understand is this figure, this effective market value, is actually shows what the rate you're being taxed is as if your market value was $176,1116, not $652. There are restrictions or caps that keep your taxes from going up, believe it or not. And because they are in place in many of our homes, we're not paying taxes based upon our market value, but a figure that's much lower. This is just one example of the information that you can get from this particular document. Here's instructions of how to challenge your market value in case you want to do that. And you can review it, the market value. You can request to update information. You can request to change an administrative error. With your assessed value, which is a key figure with the calculation of your taxes, if you want to challenge that, you can go to the tax commission, and there's instructions about how to do that here. Page number 3, you have detailed information about your property. Do we have the size right? The number of floors, the class, it'll tell you here. Beneath that, look back to last year's taxes, compare it with this year's taxes. Are the numbers right? Do you have a discrepancy? Beneath that, homeowner tax exemptions, co-op and condo tax abatements, the perhaps simplest and most direct way to save on taxes. We'll talk about them shortly. The last page of the document tells you how you can get in touch with us, and also another resource, the Office of the Taxpayer Advocate. When you get this in the mail, you'll see in-person events in this section that you can engage with us, including the Bronx event coming up February 16th. So, quick review, things that you should take away. Understand or check the website, really. You can get explanations for most of the information you want to know on the website. Understand your options for appealing your market and assessed values. They're explained on the website as well. Property tax exemptions are the best way to reduce your taxes. And by all means, come see us in person February 16th, right here at Grand Concourse at the courthouse. We'll be there to meet with you in person. Let's talk about exemptions a little bit. There are basically 7 exemptions that we administer, starting with the STAR program, which can save homeowners that earn $250,000 or less, about $300. If you are a senior and your income is less than $93,000, you can save $600 as an exemption. You'll likely, if you are not a part of the program, you'll receive those as a credit or a check to you. The senior citizens exemption and the disabled homeowners exemption, very similar programs. You have to be age 65 or above and your income $58,399 or less. For the disabled, 18 and above with the same income. And all of the owners must qualify with this standard unless they are siblings or spouses. It can reduce your taxes between 5 and 50%. Veterans exemption. If you had military service during certain times of combat or conflict, you can save taxes in 3 different tiers as a basic veteran, a combat veteran, or disabled veteran. 15 to 25% or more off of your taxes. And we'll go right to the clergy exemption, which is worth about $250 off taxes if you are actively a member of a clergy or working as a part of your main occupation as a member of a religious order. Something really for you to remember if you have condos and co-ops in your communities. By February 15th, you should notify your management if this is your primary residence. If they participate in the co-op and condo program, this could save you 15%, 17% off your taxes in most cases. But the development has to participate in the program. Simple call or email to your management will let you know that. The other exemption programs here are administered by other agencies, either HPD or Department of Buildings. I think let's just try to do this quickly. Go to our Department of Department of Finance website. Are you seeing my website?
No, we're still on the PowerPoint, Mike.
Okay, hold on.
If you stop sharing that and then go back into that share menu, you can
okay.
Use your browser.
Okay. How about now?
Yes, looks good.
Okay, let's do this quickly. For ways to save, property tax exemptions, hit the ways to save button. Down to property owners. This brings you to the overview page. The things that we just talked about here is an overview of them, qualifications, deadlines, and the like. Please know that you can have more than one of these exemptions. In fact, you can have enhanced star, disabled, veteran, and clergy. Detailed information about what they do and how to apply is underneath. Going back to the main page, if you simply type NOPV in the search engine and tab here, here is our Notice of Property Value homepage. The things that I went through quickly, detailed information about it right here. Also, how to get information about your property values and getting comparative sales, the property tax guides for 1 and 2 property for classes 1 and 2 properties are right here. Just a wealth of information. And lastly, ways to get help. This particular resource, we've crammed everything into this very dense document here, how to get assistance with your notice of property value document. If you're on a certain page and you want to know how to get additional information, it has links to where you need to go to get assistance, broken down for the different things that you need to do, the different references there. And that's basically the overview of what we have. Let's see if we can come out of this. And actually, I'm going to stop sharing. Come back on camera. So to sum it up, probably not on time, but close. Open your mailbox, look for this letter. Second thing, the second takeaway, for your community boards, for the elected officials that are here, encourage your communities to come to the event that's going to be at the Bronx Borough President's office. We'll be from 5 to 8 on February the 16th, and we'll send out this information to the borough president and be shared with you again. You can come sit face to face with folks and have conversations about all of these things. Apply for exemptions, get the assessment review started, and the information that we've presented today will be presented in detail with the subject matter experts present. So we thank you for that. I don't know if you have time for questions, but we'll stop here. But by all means, please take action now to share this with your communities so that they can save.
Thank you so much, Michael, and we'll see you here soon. I think there's a question in the chat if you can post the info session, but I know that you mentioned you're gonna send us the flyer and we'll share it out with the entire Borough Board and Service Cabinet. So thank you again for your presentation and going through that in detail. Truly appreciate you. Thank you.
Thank you.
We are, I know we are at time, but really quickly, I just want to share some announcements on behalf of the Bronx Borough President's Office. A quick reminder that the Bronx Borough President's deadline for capital budget application is set for Tuesday, January 31st. Very, very important deadline. Once again, the Bronx Borough President deadline for capital budget applications is set for Tuesday, January 31st. We're currently receiving letters of intent. So if you know any non-for-profit entity that's interested, please encourage them to write a letter, but also to submit their application in a timely fashion. We have our Director of Capital Budget, Betty McCrae, on the line if there are any questions regarding that. But for our next Borough Board, we will be hosting the public hearing on the mayor's prelim budget and the capital service needs for our borough. That's set for February 16th. Please do keep in mind that there is a second deadline submission for non-for-profit entities. That's Thursday, February 23rd. That's the OMB subsequent deadline for CAP application submission. So that's in addition to our January 31st deadline. Again, if you have any questions, Betty is on. Betty's always available. Feel free to shoot her an email, give her a call if you have any questions regarding our capital budget applications. And I will be remiss if I don't acknowledge that February is Black History Month, our favorite month. It's also on January 21st. It's also the kickoff of Dominican Heritage Month. So we do have some upcoming events. Our Black History Month event is scheduled for February 9th, and we will share save the day flyers with you all. And our Dominican Heritage event is set for February 28th. I look forward to seeing you all there in celebration. I also want to announce that the Bronx Borough President's Office, in partnership with the American Red Cross and FDNY, have launched the Sound the Alarm initiative. So we have a series of fire safety workshops around the entire borough. This upcoming January 30th at 11 a.m., we've partnered up with RAIN. So at the RAIN Gun Hill Center, we will have a fire safety series workshop, and that's a series of workshops. So we have a total of 4 left. So we have one scheduled again for January 30th. Happy to share the series as well. Please encourage your residents and the entire general body of your community board to attend our series. Again, they're borough-wide and they're going to be spread out evenly throughout the borough. Thank you all so much. I want to give a minute or two to anyone that has an announcement before we wrap. Sam.
Quick question. Do we have a status update on the community board applications?
Tom, are you on? We are working on a fantastic initiative, but I'll let Tom speak to that.
Yes, good morning, everyone. We are at the end of editing our new applications, both in English and in Spanish. And this year, and the council members and the community boards will be getting an email from us shortly once that is finally approved regarding the process this year, which is a little different. Just as an FYI, in a short version, the applications will solely be applied through our website. There'll be no more paper unless there is someone who is unable to use a computer. We obviously will have a paper option, but for the most part, we will be accepting reappointment and new applications through this new online portal. Excuse me, online portal. And it is a modified application with some additional questions, some additional probing questions, I'll say. And it is an opportunity for board members to provide the borough president and council members with their reasons for wanting to be on the community board or continue to be on the community board. We did receive some feedback last year from some council members that they wanted some additional writing, some additional information from new members as well as reappointed members, as they were not familiar with everybody that was presently on those boards. So it will be a little different. The applications will come directly to us, and then we will be able to directly send them to the council members. So the council members will have a bit more time as opposed to waiting until the end of the process where we then would copy all of these applications and then physically deliver them to you. So that piece of it has been eliminated, and you will receive copies of those applications directly in a more timely fashion. But that's the gist of it. We will send out something to everybody once the link is up, and we will provide the link and the information to the boards and to the council members.
Thank you, Tom. And once again, we want to commend the council members and community board members for giving us feedback. We've incorporated and consolidated that feedback to ensure that those things are covered. George?
Yeah, real quick, Tom. I'm just catching up on all my email. I saw that we were extended until the 22nd, which is this Sunday. Have we
Correct.
gotten word? Anything?
No, I
further?
have not. They usually wait until the day of or the day after to send it. In fact, I have a call into to Commissioner Vasquez about it as well.
Thank you.
And Ken?
Thank you. About the new application, two questions. One is, I just want to confirm with you, Tom, that the current applications would not be accepted, right? The
That is correct.
2022. Okay.
That
And
is
then
correct.
the other thing is on the currently obsolete application, there was a requirement for people to check off and have signed that they attended a general board meeting. If you only accept online applications for people that have difficulty scanning and things like that, how will that be able to be confirmed?
We're working on that piece of it, but most likely is once we receive the application from the from online, we will contact that person and send them the form that they would need to fill out for that.
Okay, thanks.
Beautiful. And I don't see any other hands raised. And so, motion to end the meeting. Thank you all so much. Again, this concludes our Bronx Borough Service Cabinet and Bronx Borough Board meeting. Thank you all for your patience and sticking through the presentations earlier today. I know that a ton of contacts were shared in the chat, so make sure you review that before you exit. Again, thank you for showing up today and showing up for your community. Happy New Year. Happy Black History Month if I don't see you before February, and happy Dominican Heritage Month. Thank you all so much. Be well.
Bye, everyone.
Bye, everyone. Good night.